not just crazy.
I
Yeah.
began grieving as soon as I found out about my mother's diagnosis.
Mhm.
And now I realize that I should have had a therapist then. I was trying to be strong and trying to take care of everything. And as it pertains to my culture, as a Black Mexican American Christian on both sides of my family, that was just something that was taboo. So
Yeah.
I didn't know that I needed that.
Right.
However, I needed it.
So I think therapy is really important. And I think that a lot of times people feel like I don't have time to do that. And really, if we're not, the best practice is taking that time, taking that 50 minutes every week or every other week to talk with somebody and make sure that you are processing your own stuff so that you have space to process theirs. I think that when we take that time to really get intentional about our own needs, even if that's the only time that you do that all week, that the level of stress, the level of cortisol that's going through and adrenaline that's going through people when they're caregivers over a long period of time, that can really wear, well, it not just can, it does, it wears people out. And so the body keeps the score. And so if we are not tending to our mental health, it's harder. And if that was not the story that some people have, that they didn't like you, like that was just not part of your story, finding somebody as soon as you can that is a grief therapist, I think is really important. I think also in the grief journey, just being patient. The Our brains physiologically change with trauma. And so the things that people could do before there has been a significant trauma a lot of times changes. I think that's a really big part of having a grief therapist that also is a trauma therapist, because all that gets tied up. If you don't have somebody that can help you piece that out, that causes problems physically, long term, and emotionally. So keeping in mind that grief, the process of grief is, it's very strange, and sometimes feeling like all I can do is cry, and sometimes feeling like I don't think about this at all, and sometimes feeling like everything is too much and I can't do anything, I can't accomplish anything.
To know that when you all go through traumatic experiences, there is a chemical reaction
Yeah,
that
you're
takes
not just crazy.